Hi everyone, I'm Dr. Anirudh from Toothpicks Dental Healthcare. Today I'm going to be talking about a simple thing that we use every day is the mouthwash, oral rinse, otherwise called oral rinse or mouthwash that we use to keep our mouth healthy, fresh and smelling good. Now, there are multiple types of mouthwashes that are available. There are mouthwashes that are available as antiseptic mouthwashes. There are mouthwashes that are used as post-operative mouthwashes to reduce the bacterial level inside the mouth, or there can be a cosmetic mouthwash, and we have the new trend of organic mouthwashes that are available. There are multiple reasons why we use mouthwash. Also, we have anti-sensitivity mouthwashes that are being used to reduce sensitivity in the mouth and teeth. Now, how does mouthwash act? The mouthwash generally acts on all the surfaces of our mouth. Okay, that includes your teeth, it includes your gums. So I very basically want to talk to you about it. Much like I don't want to bring in a lot of science into it because I don't want you to panic with what you're using right now. So what is the purpose of using mouthwash is to it's mostly used as an adjunct to the other mechanical cleaning that you do, like your brushing of teeth, your flossing, interdental brushing, your tongue cleaning, and along with that you use mouthwash as an adjunct. So mouthwash is necessary when you have all your other uh, uh, oral hygiene practices are in proper place. Now, first of all, there are multiple types of mouthwash. Some mouthwashes are recommended by a doctor to be used only for a couple of days, and you have to follow that only for a few days because using it for more number of days may cause stains on your teeth, may not be really effective on your teeth, or may not help you at all. So, therefore, you have to follow the prescription of the mouthwash. Now, anti-sensitivity to the, oral mouthwash is also used to bring down the sensitivity. Of course, you require a regular follow-up, and you will have to get it checked and then continue with these kind of oral mouthwashes. Now, antiseptic mouthwashes are generally given in cases of infections in the mouth or ulcers in the mouth where antiseptic mouthwashes are used, and that's also supposed to be used with prescription. So whatever is available over the counter, one thing that you need to remember is most of the mouthwashes that come in are having content of alcohol. Okay, most of the mouthwashes have content of alcohol, which is not good for the soft tissue inside your mouth. I'm not talking about your teeth, but soft tissue. To an extent, it's not good for your teeth as well, but it's not good for the soft tissue of your mouth. And another important thing is that you should see if it is going to be effective on your teeth. If you have a lot of calculus, there's underlying problem, and you only continuously use mouthwash just to keep your breath smelling good, it may actually lead to a problem eventually because you are ignoring the cause of the problem by masking it with different fragrances like mint flavor, cinnamon flavor, raspberry flavor, fruit flavored mouthwashes, and so on and so forth. Organic mouthwashes are also available for you to use. There are a lot of organic mouthwashes are used. I do recommend some for my patients when they ask me about the product that they have. But mouthwash is something that should be used as an adjunct. After you brush your teeth, when your teeth surfaces are clean, you coat it with the mouthwash so that the effective cleaning takes place inside the mouth. Now, what if you don't have mouthwash at home? What if you don't have mouthwash at home? Salt water is also a very good mouthwash. Okay, saline water or salt water is a very good mouthwash. Now, a glass of water with maybe half a tablespoon of salt and mix it and rinse your mouth. You don't have to gargle your throat, make it complicated. Make it as simple as possible for you. Rinse your mouth thoroughly. Make sure that there is no food debris. Make sure that there is no food lodgement that's happening, rinse your mouth thoroughly at least 2 to 3 times a day to keep your mouth fresh. Okay, that's going to help you. All the mouthwashes are going to help you basically in keeping your gums healthy, in keeping your teeth healthy, in keeping all the surrounding tissues healthy. And also, if there is any kind of ulcers which are causing pain, there are mouthwashes that bring down the pain as well, the painkiller form of mouthwash. And antiseptic mouthwash or antibacterial mouthwashes will bring down the level of infection and bacterial load inside the mouthwash. But if these things are not available, you can always use salt water. Now, this question mostly my patients ask me is, okay, I have BP, I have hypertension. How do I use salt so much? So now what I tell my patients is that you should only rinse your mouth with salt water. And after you rinse your mouth with salt water, you're going to rinse your mouth with regular lukewarm water. Okay, that is for patients who have problem of hypertension and other things. But otherwise, you will not be ingesting a lot of salt otherwise, because you're going to be spitting out. You have to rinse your mouth and you're going to spit it out. Now, this is extremely important, and I hope you'll all follow this instruction. And as much as possible, use salt water to rinse your mouth whenever possible to keep your mouth clean. That's also going to improve the oral hygiene. That's also going to improve the bad breath that you have, or if you have dry mouth, there may be another some other medication that is given, or there are certain medications when you take, you have bad breath in the mouth. Okay, salt water rinsing is kind of going to help in reducing the amount of bad odor that comes out of your mouth, and also keeps your teeth and gums really healthy. So any questions you have, you can always message me back, okay, on 810-592-8839 or 9632-5636570. If I'm not wrong, I'm repeating the number: 9632-636-570. So you can send us message on WhatsApp, or you can also message us on Facebook. We will get back to you on solution. I hope during this coronavirus pandemic and lockdown, I hope all of you are safe at home. Be safe, rinse your mouth well with salt water, and keep your mouth and your oral hygiene really, really good. Don't give your tooth a hard time during the hard times. Thank you so much.